Hello, good morning, dear student. Okay, so thank you for attending to this class. Yes, I'm sorry because I cannot attend the class in persons because now I'm in the uh, therapy agenda due to lower back pain. Yes, and then I have to take rest. Okay, so for today's topic, I would like to share about caring for and assisting other to stay safe from insect and animal bites and sting. Yeah, I think the purpose of the class today is I would like to share about how to stay safe, and maybe you can use this knowledge if you have the family or friends uh, have the insect or an animal bite. Okay, so let me continue to the next class. Okay, uh, the first thing is insect bites. Maybe you know, like in Bangkok or in your hometowns, if you are not from Bangkok, there are many insects around us, right? And some of them are friendly, or we can say not harmful. Yes, but some of them can be harmful of for us. And like you see, some of them can transmit the disease such as malaria, yes, kinds of mosquito, or other can bring like very severe condition to our body. Yeah. And here is like you can see the picture. Yeah, if you have like a sting, yeah, from bee, for example, like bee, you know bee, right? You can take out first the stinger here, yeah, and then if it is needed, you can have some antihistamine, yeah. But if you have like a medical background, maybe you can do this action. But if you didn't have any medical background, maybe you can go to Chula Clinic or the nearest medical center. But here, like usually like antihistamine to treat the local reactions. It is like the jelly gel here. Or if it is needed, if you feel pain, you can use the ibuprofen. Yeah, here for an anti-pyretic or pain counter, right? And we can watch closely what is the sign or any signs of anaphylaxis. Anaphylaxis mean like you feel like itchy or redness in the around area. So maybe if it is like bigger, yes, since the bee hit you, and maybe if you have like more complicated symptom, maybe you can directly go to the medical center, right? But usually it's depend because ones and other are different in the reaction, yeah. Okay, so this is the bee, you know, right? Bee, wasp, and sting and other insect bite like maybe an, a specific type of ant or like a cockroach, yeah. So you have to know what insect bites you, yes. Yeah, and then we have to firstly remove the sting by scraping and never squeeze the side. Usually if you like squeeze the side and it will spread, yeah. So avoid to do this one, and wash the area and apply antiseptic cream. Yes, and then keep the sting side rested and elevate and cool. Yeah, and if it is needed to relieve the pain, you can have like do the cold compress. Yeah. And then local swelling and irritation may last for several days. Yes, yeah. So if you think it's okay, maybe you can do the first medical treatment. But if it is like going to be like severe, maybe you can ask further medical assistance from the nearest clinic or primary care. Yeah. Yeah, and this is for your informations. And yeah, you can see here if like only female Hannes bee die when they sting and other bee wrap life to sting another day. Yeah, you can see here if the female after sting they die, but the other like this type they still alive. Yeah. And this is the wasps, and this is the bee. Yeah. For the bee, when a bee sting, the bulb of the end of the sting anchor into the skin of the patient. The venom gland continue to pump a venom into the patient. That's why we have to take immediately remove the thing because the venom still continue to pump. Yeah, but for the wasps, it's time of wasp sting. Venom injected into the upper layer of the screen. There is no bulb at the end of the wasp sting, and the venom gland remain inside the wasp body. The amount of venom injected can be regulated. Yeah, so I think I have experience. uh, uh, when I was child, I have experience to this event, yeah, even bee and then wasps, yeah, and it is very painful, yeah. You can see here honey bee. So this is yes, and this is the venom such and stinger here. Yeah, that's why once the bee hit you and you have to remove this part, yeah. Okay. Okay. And this is the different type of sting. Yes, and this is honeybee. Uh, and you have to know the criteria sting when threatened. Yeah, so when you have when you near to the bee and the bee feels threatened, they will hit you or sting you. Yeah, and this one is wasps like dingle when flying don't leave stinger. Yeah, usually they didn't leave a stinger, but you just I mean like if you're close to him and they will hit you. Yeah, and yellow jacket, this is I think uh this is more severe, so don't try to close with this one. Yeah, you can see like it is like a tiger right here. Yes, nest in and on the ground, don't leave stinger and can cause skin infection. Yeah. And then this is the fire ant, like I mentioned before. So sting multiple time and very quickly, and usually if heat, it can cause like itchy and also pain. And this is the hornet, yellow face, white face, net resemble pepper mace. Yeah, it's like similar. Yeah. So you have to recognize different sting. Yeah, and which insect already stung you. Yeah, or your friend. So you have to know each characteristic of this different type of insect. Yeah. Okay. So this is the first aid in bee and wasp sting. Yeah. So the first aid you have to know is after you recognize which insect sting you. So maybe the sign and symptom can be like burning pain in the sting area, and it can be like a red spot in the sting area and swelling around the sting area and also redness. Yeah, and I have to say, different people have different reaction to the symptom. Yeah. And then what is the first aid? You have to know, of course, follow the guideline. Like I mentioned before, if it is needed, like antihistamine or painkiller, right? And remove the sting if it is from the honey bee, and apply the cold compress or ice pack to make the sting area don't spread, right? And seek medical assistance if it is required. And this is the last one is very important because I said to you, every people have different reactions. So maybe one person will have difference from another person, but if you think you are not tolerant with the symptom, you just seek immediate medical assistance. Yeah. Okay. And this is provide first aid management from the sting or from the bite. Yes, as I mentioned, the first step you have to remove any stinger, wash bite or sting site, apply as cold compress, treat serious reactions the same as snake bite. Yeah, monitor breathing, be alert to allergic reactions because everyone have different. Look, medic alert, crack or emergency insect bite treatment kit on the casualty. Yeah. Yes, and for minor bites, clean the wound thoroughly with soap and water and apply topical antibiotic, prevent infections, and cover the bite with clean bandage or a gauze. Yeah, you can see like here. Okay, the next one is scorpion bite. Yeah, you know the scorpion, right? Yeah, scorpion sting can be very painful and the pain may persist for several hours. Local redness and numbness often occur. I still remember when I was a child, because I stay in the village, so of my neighbor uh, bite by the scorpion. Yeah, the scorpion. And you know, I think there are several type of scorpion, but if you know the scorpion king, the like blacky one and small one is like have a strong venom compared to the like to another type. Yeah. And of course, it's very painful. And I still remember once the heat, they have to implement the tourniquet. Tourniquet, yeah, yes. I have to tie the hand or the leg, and then uh, we have to. They give like traditional medicine at that time, but I'm not recognize what is that. Yeah, because that's when I was small. Yeah. And some people are allergic to the skin and can rapidly develop to serious conditions. And the most dangerous condition is anaphylactic shock. Usually, uh, the skin is like there are many redness and sort of breathe. Yeah, so this is dangerous. So that's why we have to know what is the first medical treatment for this particular scorpion bite. Yeah. Yes, for example, like this one, this is the symptom, this is the scorpion, right? And this is the danger one. Yeah, the tail. Yeah. Yes. What are the symptoms? Patient experience painful, burning, tingling, numbing sensation at side and of the scorpion thing. Usually, like painful and burning is the very common symptom. Yeah, and there is slight redness scenes in the scorpion sting site. Yeah, I believe if you see in the video, you will see like the redness area in the site of the sting. Yeah, and just like bee sting, patient can also develop allergic reactions to the scorpion, and sometimes it can be like life threatening, or we can see the anaphylactic shock. Yeah. Okay, what are the treatment for the uh first aid, right? So apply a tourniquet. So you know the tourniquet, if you didn't have any tourniquet, you can use like the bands, any band or like the yes, something can use to bind the area that sting by the scorpion. Yeah. Apply approximately to the site sting release every 5 to 10 minutes. Yeah. So apply it and release, right? Don't just apply it very tight, but never release is also danger because the regulatory system in the blood flow will be interrupted, so it's not good. And of course, you can apply the ice pack, yeah, to the region to slow down the absorption of the poisons, yeah, or the venom, right? And then shift the patient to the hospital, yeah, this one. And centipedes and local redness, itchy, pain are common to this condition. Severe pain is something experienced, yeah. And apply antiseptic to the bite side, yeah. I think if you didn't have an experience to tackle this one, just go to immediately to the nearest medical center or the primary care or the hospital, yeah. This is like, yeah, I said to you right here. Highly venomous, yes, here, and then midly venomous and weakly venomous, yeah. And I also, like I mentioned to you, the black one and small, yeah, yeah. And this one maybe because in some country they will have like different type, right? But in here you if you see like here thick tail, thin pincer, yes, maybe life-threatening aspect class 2 and 3 symptom like here. And this is the medium one. Yes, and this is the class 1 symptom, right? Yeah, is weekly venomous, right? Class 1 and class 2 scorpion envenomizations maybe calm the patient, alert security for safety officer, arrange from transportation, and then make the patient comfortable, transport the patient professional medical assistant, yeah. And then class 3 the same, calm the patients, alert security or call 911 and close monitor vital sign, transport to the medical center, and maybe anti-venom may be required for this one. Yeah. This is the first aid. See, for the scorpion bite, maybe the conservative way is bring to the medical center. Yeah. Okay, and this is the first aid for the scorpion sting, call 911 or any emergency call in Bangkok. Yes, and uh, particularly if there is a breathing problem or other severe condition or symptom. And always monitor the breathing and then have the CPR if it is needed. And of course, wash the area and put ice cold to prevent the spread of the venom and seek urgent medical attentions unless the symptom is very mild. Yeah. So you have to remember this step, right? So that's why if you didn't have any experience or medical background, just seek the first I mean like just call 911 or seek help from the primary care or medical center immediately. Okay, the number three is snake bite. Okay. Okay, in many country, snake bite become the very serious health problem, and because many people afraid of snake or snake bite, even me, right? Yes, and then even though you can you see like it is actually harmless snake, but people still panic after a snake bite because yes, because the snake is scary, and then yeah, we all consider this like more harmful rather than beneficial, right? And uh some snake become like or have like very poisonous, and some maybe not to danger, yeah. But let's see what we uh can explain in this slide. Okay, bite from sharp point teeth cause deep puncture, yeah, puncture wound that can carry germ for into the tissue. Snake bite result in puncture wound cause the fang and fang of the snake. Yes, this is the snake bite meaning. And then you can see these two sign here, right? Yeah, what the sign and symptom of snake bite? Okay, the first one is a pair of puncture mark. You can see here, there are always two pair of puncture mark here. So if this is the sign, so you might be worried that this is from the snake. Severe burning pain at the site of the bite. Yeah, redness, swelling around the bite, and can be like nausea and vomiting. Yeah, and difficult in breathing and speech. Yes, and dimness of vision and increased salivation and sweating. Yeah, this is you might be remember the sign and symptom of snake bite. And what are the first aid management? Of course, give the comfortable positions to the patient or the victim, and ask the patient to do not move the affect part. Yes, don't move, because if move, the venom will be like spread easily. And give sympathy to the patient to reduce fear, anxiety. You can hear the music or stay calm until they got the medical treatment. And one area always below the heart level. So if it is in the leg, so the leg must be lower than the heart level in order it's maintain the flow of the blood. And tight apply bandage to 3 inches above the bite side to prevent spread of the venom. You can see here, so we can use the bandage among or between the outside the area of the bite. Yeah, here. This is non-venomous snake, maybe, and this is the venomous snake. Yeah, you can see the different, right? If there is two sign here, this is like venomous snake. Okay, point to be remember. Yes. This is what you can do to prevent the snake bite. Yeah, the first one, don't walk into long grass. If you do, always watch your step. Okay, here, because snake maybe hide behind or inside the long grass. Yeah. Then the second, it is very recommended you check your sauce if you left outside, because if you just play in the garden and you put the sauce, maybe the snake inside your sauce. We don't know, right? So you have to recheck before you use it again. And then wear long pant and cover sauce walking in bushland or long grass and remote area or gardening. So you have to protect yourself. So wear the jeans or long pant, and also wearing the shoes is very important. Yeah, and block off any entry point to the house, because snake like the cold bathroom tiles or cold vents. I still remember when I was in Taipei. So because my condo is in the between first floor and B1, because the ground is like elevated. So at that time, I remember when I go for vacations for like 1 month. I yeah when and I back again to Taipei. So I go to the bathroom to see everything is okay, and I see there is the son of the snake inside my bathroom. And at this time, I just see around under the sofa, under the bed, or under the cupboard, all around the area. I just look around, because if there is a son, maybe there is a mom or the dad, right, of the snake. Yeah. But fortunately, I didn't find any snake inside. Yeah, luckily. And if you see a snake, like steer, like here, like clear, and stand still to avoid aggravating of the reptile. Yeah, just see here and just maybe just move away, and then try to handle or kill the snake. If you are not professional, this is uh special notice for you. Don't be the hero if you didn't have any profit certified animal, or or you are not professional to handle the snake. Don't try, yeah, to be the hero. Yeah. Okay. Okay, this is the guideline. Yes. So if there is someone experiencing the snake bite, suction should not be applied to pull the venom. Maybe if you watch the drama, like Indian drama, after the uh, King Cobra bite the people and then they do the suction, right? Using the mode. Is this not recommended? You are not in the drama. They are only drama, right? Because one, this is ineffective and it is also harmful to the helper. Yeah. So don't try to do that one. This is only in the movie. And the second one is properly perform compressions and immobilization of the extremities should be applied in the first aid. So just do the bandage and try to avoid mobilization. So just relax and make sure that the extremity have the lower positions to the heart of the victim, right? And when performing compression for the snake bite, the pressure applied should be a bandage that will allow the finger to be inserted under knit. Yeah, so don't too tight, but just make sure that if you put the finger, you still can have like the finger go inside. Yeah. Okay. In the region where the venom snake are found, contact the local health center to find out where and how to get antivenom for the victim of snake bite and what specific treatment are needed. So this is you should do. Yeah. Okay. Uh, and this one is what you should do and what don't do during the snake bite. Yeah. The first one, immobilization of the effective limb. Yes, if it is in the foot, so you just do the here, the bandage and immobilization. This is what you do. While you're done, take the patient into tank tring or snake charmer or treatment. You see here. Yes. What you should do, apply basic first wash the wound with soap and water. Yeah, this is like I mentioned, shock the wound. It is only in the drama or the movie. Don't do this one. Cut the wound open. This is not necessary to be done. Okay. Okay. What is the guideline? To remove a tick, grab a tick as close to the skin as possible and very fine forceps tweezer and pull it gradually but firmly out of the skin. The bite side should be thoroughly disinfected with alcohol or another skin antiseptic solutions. Avoid squeezing the tick during removal because squeezing may inject infect material into the skin. Use the gasoline, petroleum, other organic solvent to suffuse the tick, as well burning tick with a match should be avoided. If a rash develop, the patient should be see a physician or doctor in the case of antibiotic or vaccination are indicated. Yeah. Okay. Contact medical center to find out the insect-related disease are common in region, as well as preventive measurements such as use repellent or blender, wear long sleeve, long pant, especially at dawn when the insect are active. Yeah. Get in touch with medical personnel on how prevent this disease, vaccination from tick-borne encephalitis and other like malaria prevention and other, right? Okay. Okay, so we have the insect, we have the sting insect, and then snake bite. Yeah. The next one is animal bite. Okay, you know he's this one, the dog or the other animal, like yeah. So bite is the one received from the teeth of animal, including human. Animal may bite in self-defense, so you have to know in an attempt to prey in food and as part of normal interaction. So yes, in the natural life, you know, like maybe in the forest, they try to survive or protect themselves. So this is natural, and you have to know if it is wild animal, so try to prevent yourself. Yeah, don't be too friendly to that wild animal. And this is the animal bite. Can be like occur from the household pet, for example, like dog, and then cats, and rarely a child can come into contact with wild animal or vicious dog. Yeah, yeah. And it can be minor bite. Do not break the skin, and also major bite can break the surface of the skin. And the danger is because if the some animal contain the virus can infect can transmit it into the infected saliva through the bite and wound, for example, like rabies and other, right? So the danger one is can cause the brain inflammation through the virus transmission. Yeah. And this is the first aid for the dog bite. Yeah, wash the bitten area or wound with a clean running water along with soap. Gently press and dry the area with the clean towel. Apply sterile dressing over the wound and control the bleeding if it is severe and seek medical treatment if it is needed. Okay, so I think this is the last part, right? Mnemonic in first aid. So this is what you always remember, right? Okay. So what is the principle? The key guiding principle or purpose of the first aid is often given the mnemonic 3P. What is the 3P? 3P, 3 point govern all action undertaken by the first aid. Prevent, preserve, and promote. Prevent further injury and preserve life and promote recovery. Yeah. And another one is useful mnemonic PEP. PEP is always PP is a way of remembering what to do in someone is bleeding. PEP. Position that casually position of rest. E elevate above the level of heart. E expose examine and in the wound. And P pressure apply directly pressure, right? And there another one is stop first aid for burn and scalp here. If you got a burn or any burn situation, so you can see here. Strip hot cloth jewelry if possible. Yeah, stop, right? T turn on cold tap. Never use ice. Run the burn under cool water for 10 to 20 minutes. Keep the rest of the person warm. O organize medical assistant, contact 911 or other applied emergency call. P protect burn with cling film or clean cloth, no dressing, fully clothed, full flake coat and cream lotion. Give painkiller. Okay. Okay, this is the other one. See, sit or lay, examine, elevate, and pressure. Price, protect, rest, ice, compress, and elevate. Okay. Riser, rest, ice, compression, elevate, and referral. Yeah, so referral mean bring to the hospital. Okay. Okay, for burn. Back away to safety, uncover soil burn clothing constrictive item, rinse under the running tap water 15-20 minutes, in close enclose the wound with clean, damp cloth and cling wrap, and then seek medical help from doctor or hospital. Okay, so just this is like the first aid you have to remember. Another one is stop burning. First aid. Stop. Strip hot cloth jewelry. Turn off cool tap. Never use ice. The same, right? Organize medical assistant and protect burn with sling film or clean cloth. Yeah, here. Okay, maybe you see uh the campaign in the first aid, right? Okay, the next one is for fire safety. Raise. Rescue anyone immediately danger of fire. A. Alarm. Activate the nearest fire alarm and your fire response telephone number. C. Contain fire by closing all door in the fire area. And then E. Extinguish small fire. If it is cannot be extinguished, leave the area and close the door. You see like here, right? So you should know location the nearest fire extinguisher and alarm pole box. The fire location, room number, and building. All fire exit in your work area or in your area. And this is how to properly operate the fire extinguisher, right? You can use the pass, PASS. Pull. So pull the pin release lock and press a puncture lever and aim the extinguisher in the base of fire and squeeze. Squeeze handle the fire extinguisher and sweep from side to side at the base of the blade. Yeah. Okay, this is the same. For the bleeding, you can use the rice. Rest the injury area for 20 for the hour, 48 hour, and give the ice for 20 minutes at the times, maybe 4 to 8 times per day, and compress to help reduce swelling, and then elevate the injured limb 6 to 10 inches above the heart. Yeah. Okay, this is the first aid. If you see the victim, like for the rescue, call emergency and check vital signs, left chin, check breathing, right? Head chin lift, and give rescue breathing. But this is not recommended right now, so you just do the only compressor for the CPR and wait for help. Yeah. So on except for this one, this is not recommended. Yeah, because it's can like transmitted the disease. Yeah, like the shock the phenom is also not recommended. Yeah, and this is CPR. CPR, you can see the CAB, compression, airway, and breathing, right? But now the guideline is for the lay person, you can do only compression, so just only compression. Yeah. ABC, airway, breathing, circulations. Airway, is there any blocking from the mouth? If it is, so you have to pull it out, or you can do only pressure, yeah, and breathing. If it is for lay person, no need to do the breathing. But for the medical team, they will do using the equipment, yeah, and circulations, yeah. So just maintain the circulation is continue, yeah. And this is Dr. ABCDEE. This is only for your information, right? Yeah, but I think to do this one, you have to at least follow the workshop or certification of the CPR. Yeah, and this is the CPR. Yes. Yeah. I think in other class, in other section, Ajahn Kung will uh invite the speaker or teach you to do the CPR. Yeah. And this is the adult CPR for your information, how they do the CPR combined with IAD. Yes. I think that's all what I can share to you. I'm sorry again because I cannot attend in person, but if you have any question, just send me line or contact me by email. Yes, I hope you enjoy your day. And then nice to meet you. Thank you very much for your attention. See you. Bye bye.